Thank you for joining us with Visualizing Microbiology. My name is Rodney Anderson. I'm a professor here at Ohio Northern University. I teach the Med Micro class. What it is I want to do today is explain a little bit about diphtheria caused by Corynebacterium diphtheria.
The microorganism of diphtheria is Corynebacterium diphtheriae. Some biological features are it's gram-positive, non-motile, and there are 3 strains that cause toxins. They are mitis, intermedius, and gravis. To produce toxins, amino acids are consumed. Some physical features are that it is non-capsulated, club-shaped, and bacillus.
Ew, why do you cover your mouth? Thank you.
For transmission, in addition to respiratory droplets, you can get skin lesions. For examples are touching open sores, touching clothes that touch the open sores, coming in contact with an object that has the bacteria on it.
My throat hurts so bad. What is happening? I can't even drink my Diet Dr. Pepper. The pathogen C. diphtheriae attaches to the epithelial tissue of the tonsils and the pharynx. C. diphtheriae infects the epithelial layer and initially avoids circulating antibodies and cells of the immune system. The toxin that is produced by the bacteriophage infected organisms inhibits cellular protein synthesis. It also causes programmed cell death of surrounding cells, leading to damage in the pharynx. This allows entry into the bloodstream, causing damage to internal organs.
What brings you to outbreak care today?
My throat has been hurting really bad and I can't even drink my caffeine-free Diet Dr. Pepper. Mild symptoms include sore throat, fever, swollen glands. Some severe symptoms include thick gray or white patches at the back of the throat, breathing problems, or swollen lymph nodes. Complications include damage to heart muscle, nerve damage, loss of the ability to move, and lung infection. Symptoms may develop as fast as 2 to 5 days after exposure. Death occurrence is about 10% with treatment and about 50% without treatment.
Well, it sounds like you have some sort of bacterial infection of the throat. We'll have to do some initial tests. Meanwhile, because of the symptoms you've given me, I would strongly recommend immediately going to the hospital. We'll call you when we have the results of the test.
A diagnosis of C. diphtheriae can be done by looking at the culture and toxigenicity. Examination of the cultures can be from the tellurate blood agar plate. This will be looking for suspicious colonies, and that will have to be identified. And then for the toxigenicity testing, they will be using a modified Alex gel diffusion method, and you will be looking for white lines of precipitation to form from a filter bed.
So you said you're coming today as a recommendation of your doctor?
Yes, he told me to come immediately. He said he would call me once the results of the culture test are done.
Hello, Caitlin. We have the results from your culture test, and the bacterial infection you have is Corynebacterium diphtheriae.
Thank you, doctor. As you recommended, I am at the hospital getting seen.
Good thing that you did that. Part of treating diphtheria is speed. The faster the medication is administered, the better the chances are of getting well faster.
That was my doctor. He said that the culture came back positive for Corynebacterium diphtheriae.
That's good to know what we're now dealing with. The reason why your throat is hurting so much is because Corynebacterium diphtheriae releases a toxin to inflict damage. So the treatment will consist of 2 parts: antitoxin and a drug regimen of antibiotics, usually penicillin or erythromycin. Since your throat is hurting so bad, would you be interested in having injections instead of oral tablets?
Yes, I would rather have an injection rather than a tablet. It's been hard enough to swallow food and drinks by themselves.
Okay, I'll have one of my technicians come in here and help give you the first dosage of the protein penicillin G.
Okay, the process of the injections are twice a day, around every 12 hours, usually once in the morning and once at night. You want to inject 300,000 units to 600,000 units a day. And you will be doing this for the next 14 days.
How long will I be contagious for?
Once the first dose is administered, after 2 days you won't be contagious. However, once you get home, disinfect everything you have touched in the last 2 days since the disease can spread via surfaces. And remember to wash your hands.
Treatment options for diphtheria are the erythromycin. It could be either orally taken or injected. You're looking for 40 milligrams per kilogram per day with a minimum of 2 grams per day for 14 days. Another alternative is a procaine penicillin G injections. This is an intramuscular injection between 300,000 units to 600,000 units every 12 hours for anyone over 10 kilograms for 14 days. Or you have oral penicillin V. You'll be taking 4 250 milligram tablets a day for the next 14 days. Another part of treatment is the antitoxin.
Here's a prescription for the medication for your local pharmacy, and here's information about the medication you're taking and information about
I just
diphtheria.
gotta text my prescriptions in.
Yeah, here it is. Just to let you know, you will have to refrigerate it when it's not being used, and you have to shake it well before you do the injections. Do you have any questions for this?
My throat doesn't hurt anymore. I can finally drink my Diet Dr. Pepper.
Getting vaccinated is the best way to prevent diphtheria. Healthcare professionals give highly effective diphtheria, tetanus, and pertussis vaccines to children younger than 7 years old. The vaccine contains a denatured toxin that stimulates a protective immune response but is not pathogenic. Older children, teens, and adults get Tdap and TD. Diphtheria is a highly contagious disease that requires urgent insulation to reduce the risk of spreading the infected bacillus. Covering your mouth when coughing and sneezing is very important in order to prevent the spread of this pathogen. If you have diphtheria and have an open sore, make sure it's covered to prevent the risk of spreading the pathogen to others.